This video will demonstrate how to do a proper patient assessment. Before beginning your assessment of the patient, carefully assess the scene, noting any safety issues that could affect you and your fellow rescuers, bystanders, or patients. If dangerous conditions are present, do not enter the scene until it has been made safe. Safety issues can include, but are not limited to, fire or electrical hazards, the presence of hazardous materials, dangerous traffic or weather conditions, hostile individuals, the presence of weapons. As part of your global survey, ask yourself these questions. What happened? What was the mechanism of injury? How many patients are involved? Multiple patients will require additional resources. Does the patient appear critical? Are other resources needed, such as police, fire, rescue, hazmat, or other? Based on your assessment of the scene, don appropriate personal protection equipment. Once scene safety and personal protective measures have been taken, begin your primary survey. The purpose of the primary survey is to identify and correct any life-threatening issues as they are encountered. Life-threatening compromises include, but are not limited to, inadequate or threatened airway, impaired breathing, significant bleeding, either external or suspected internal hemorrhage, abnormal mental status, penetrating trauma to the head, neck, torso, or pelvis, amputation or near amputation above the wrist or ankle, trauma in patients with serious underlying medical conditions, patients who are less than 5 years of age or over 55 years of age, patients with burn injuries, or pregnant patients. If any life-threatening compromise is identified during the primary survey, correct the threat and consider the patient to be a critical patient. When assessing and treating a critically ill patient, limit the time you spend on scene and the number of interventions you perform. Prepare for rapid transport to the closest appropriate facility. While assessment is taught in a linear process, multiple steps can be performed at the same time, and in some situations, the process may even be completed out of sequence. For example, you might apply direct pressure to control severe external hemorrhage before you assess the airway. The first provider assesses the patient's responsiveness if it is not already established. If spinal injury is suspected, the first provider assumes a position above the patient's head and initiates manual inline stabilization of the patient's head and neck. A equals airway. Assess for airway compromise by looking for foreign matter in the airway and listening for abnormal airway sounds, such as gurgling or snoring. If the patient's airway is compromised, open the airway with a trauma jaw thrust maneuver, clearing the airway if needed. B equals breathing. Assess for spontaneous breathing by listening for air movement and watching the chest rise and fall. Is the patient's breathing absent, too slow, too fast, or adequate? Auscultate each side for the presence of breath sounds. If the breathing is inadequate, provide or assist ventilations with supplemental oxygen. If the patient's breathing is adequate, provide supplemental oxygen. C equals circulation. Assess the patient's circulation by checking for signs of gross external hemorrhage. If such signs are present, apply direct pressure or other means of hemorrhage control. Check for the presence of a radial or carotid pulse. Is the pulse absent, too slow, too fast, or adequate? If the pulse is absent, begin resuscitation efforts if indicated. Are there signs of internal hemorrhage, such as the mechanism of injury and injury patterns? The provider may need to expose the patient's chest, abdomen, back, and thighs to assess completely. Are there signs of shock, such as rapid pulse and breathing, pale skin color, cool, moist skin, or decreasing mental status? D equals disability. Continue the primary survey by assessing for neurologic deficits. Is the patient awake and talking normally? If not, does the patient respond to verbal or painful stimulus? Are there reversible causes of disability, such as hypoxia, hypoglycemia, or narcotic use? Assess the patient's pupils. Assess for fluid draining from the ears and/or nose. E equals exposure, environment. While respecting the patient's privacy as much as possible, continue to remove the patient's clothing to visualize and assess the major regions of the body, including the chest, abdomen, pelvis, and thighs. Cover the patient whenever possible to maintain or conserve body heat. If the patient has been identified as a critical patient, he or she should be packaged for rapid transport to the closest appropriate facility. Securing the patient to a longboard will serve as a rapid full-body splint. Continue to reassess the primary survey and effectiveness of treatment until the patient is delivered to the receiving facility.